Hello, Dr. Elizabeth Walker is here with us today on Airway Circle. We are the Airway Connection. We are so thrilled to have you here. Thank you so much for spending your time and being able to talk to us today. It's so good to have you and so nice to meet you in person, virtually.
Thank you. It's so nice to meet you too. And honestly, it's an honor to be here. It's always a thrill to connect with like-minded people, to ask questions, answer questions, and really to collaborate in this because it's just about time for it not to become a niche conversation anymore, isn't it? Like
That
really,
is
let's
so
make
true,
it
yeah.
mainstream.
Agreed. That's
Yeah.
exactly right. There's so many providers out there who are just not either A, interested in moving forward with continuing education. I mean, we all are because we have to
Yeah.
make those requirements for our licensure. But at the same time, what is it that they will accept as truth? And their perspective, of course, matters to us, just like we all start somewhere. And when it comes to learning something new, it can be intimidating. It can be very intimidating. So
Yes.
being able to have that open mind and that open communication and to give that person the space to ask questions and to have
Mhm.
doubt,
Yeah.
because, we were once there.
Absolutely,
Yeah.
absolutely. We don't know what we know until we know it, and that's actually part of the problem is that we were taught everything so well, but incorrectly, or not uh, enough of what we didn't quite go down the path we needed to when we started looking at the nose or human bodies in general. Because if
Yeah.
in medicine and in dentistry, if you're like me, we learned on a static body. We didn't learn about the bodies in dynamic motion. And guess what? We actually move. We need to
We
breathe. We
do.
compensate. So yeah,
The,
yeah, you're right.
the whole tensegrity of the human body is it's so intricate. Well,
It's
I
beautiful.
think you and we're going to have a great conversation today. I'm really looking forward to it, Dr.
Thank
Walker.
you.
Thank you
Me
again for
too.
being here. I'd like to introduce you. So what we'll do is I'll go over your introduction of
Okay.
you, and then we'll just start jumping into some questions because we don't have a presentation prepared. So we're gonna get right in there. And I'm so
All
sorry for
right.
the background noise that I have joining us today, if that is coming
I
through.
can't hear a thing except your beautiful voice.
Thank you. Excellent. Well, presenting Dr. Elizabeth D. Walker, an airway-focused orthodontic specialist, international educator, and founder of AirwayZ, a platform dedicated to advancing airway-centered care through education and multidisciplinary collaboration. She earned her dental degree from Boston University and completed advanced specialty training in orthodontics, dentofacial orthopedics, sleep-related breathing disorders, and craniofacial pain. With over 16 years of clinical experience, Dr. Walker has helped patients address TMJ disorders, sleep-related breathing concerns, and craniofacial development by combining advanced diagnostics with a collaborative whole patient approach. Today's topic is the airway connection. So welcome again. Thank you for
Thank you.
being here.
Thank you. What a lovely introduction.
Wow, I really would love to take credit for it, but I really can't. The Airway Circle ladies, and especially she really does know how to put words on paper so that we can look good, and
Yeah,
we love our
made me look
editors.
good. Good.
I really have a lot of questions because I would love to just pick your brain when you're here with us today. First and foremost, I think our entire audience would love to know what led you to become airway focused in
Right.
your orthodontic career.
Wow. I think it's a great question. I think it's a funny one. I was actually my father's an orthodontist, Dr. John Walker. He's in the Boston area, and so he'd been practicing regular orthodontics just like everybody else for his entire career. And as I was graduating the residency, he said he's going to go down to, gosh, I forget where it was, maybe Tennessee or something, or Florida. I don't remember, where he was going to learn about the CBCT, the ICAT. And I said, Dad, we don't need that. I just learned the slob rule. We can see things with a 2D image. We just need the pan. We don't need that. Like, let's not spend the money on this or that, And he's like, oh, okay. And he went down anyway. And there was a presenter there who said, not only can you see in this 3D image the impacted canines, the impacted teeth, but you can see the entire airway above and behind the jaws. And if you're an orthodontist, you're responsible for it. My dad, like, that was a mic drop moment. My dad stopped everything that he thought he knew and realized we need to shift our perspective on this. Like, it's just like, it's always been there, but then the light turns on and you can see it. Someone pointed it out as being the most obvious, and it's absolutely true. If we have the ability and requirement of this diagnostic in orthodontics, then we need to be able to take responsibility for that and manipulate it. So that changed everything. So he came back, he said, "Oh, I got the ICAT." I went, oh. And then I learned he said, "We're going to this course." And we went and learned all about airway and its relationship with everything in the entire body, because there is a relationship with our breathing to every single thing in our entire body. And that's really where the broad title of my topic was the Airway Connection, because we can talk about anything you want and we'll be like, yep, breathing, nose, right? I mean, the nose is the most important organ in the entire body. Breathing is the most important thing we do. So it actually matters which hole we're using in order to get our air. Right. So that was it. I never looked back. So, it's funny though, is, because I think a lot of doctors or dentists or orthodontists or whoever is appreciating this new information, which is as old as time, right? This new approach, which is breathing, which is as old as time. It's so hard to say it's new because it's old.
Right. Yeah. The whole concept of it. Yeah.
Yeah. So I didn't have too much
awareness.
What we say is we had to unlearn some things, right? We had to unlearn some, and I didn't have that much to unlearn because I was just getting out of my residency program. So it was really an optimal time for me to embrace and embody and commit. When you take that oath, it had a whole new meaning all of a sudden for the benevolence and do no harm and only do, it really took hold, and here I am. I haven't looked back. I mean, there's a lot in between.
We are so lucky. What we as in myofunctional therapists and other adjunctive therapy to expansion and airway and everything else that covers underneath the airway umbrella for improvements. As a myofunctional therapist, I would love to just replicate you, duplicate you, and place you all around the world, which would be fantastic. And what else that we can do to with your topic called the Airway Connection, that phrase in itself clinically, I'd like to dive in a little bit more about that connection. So I'd like to talk about breathing and orthodontics and that connection, that diaphragm, especially because it's just so important with the whole body. Why do you believe airway should be part of every orthodontic evaluation?
Oh, well, let me just backtrack. It should be a part of every medical and dental evaluation, right? Because it's not just a connection in the entire body, it's a connection across all disciplines, right? So, but, and then now I'll go right back into orthodontics and airway, but there is no exception, there's no exemption. This is why, so the evaluation needs to include breathing, because if there's any obstruction anywhere along the nasal breathing path, our airway is only as open as its narrowest point, like a chain is only as strong as its weakest link. And so if we have any control over those obstructions, we have control over what's happening above the nose, above the maxilla in the nasal passage. And we also have control over what's happening in the throat if we're making more tongue space, so we are kind of a quarterback or a leader in the triage and diagnostic phase and treatment planning phase for what each individual patient needs. We can't quite get to that valve, but we know how to manipulate it with some nasal dilators or some strips, or get you to the right provider who can help with a more plastic permanent change if necessary, whatever it might be. Some people go for it. Some people, we have to understand our patient and what they're willing to do and what they're not willing to do. We all know this, that we want some people want, can you just put me in surgery and have this done in 6 hours? Like, yes, but I'm never going to and then there's someone else, I'm never going to have surgery no matter what you say. Okay, we have a solid solution for that. Well, I'm not even going to do orthodontics. What can you do? Well, we can actually give you something that you can wear in your mouth to prevent collapse of you, right? So we have to know who we're talking to and really have solutions for everybody, because there is not a one-stop shop in any of our departments for a fix, right? You know that, right? So, when we have those obstructions anywhere along, whether it's one or all of the potential points obstructed, we develop that forward head posture, right? And with that forward head posture, that has an effect orthopedically on the compensation, the gravitational organization of all of our structures on our stack as we're upright, right? But there's also when that compromises, think about that. All of our nerves are going right down our spine too. So and where do our nerves go? Everywhere, right? Every single system is dependent upon what's happening in this spinal column, which means that everything is depending on what's happening in this nasal passage, right? So, there, and now you can, just kind of skip to the end. Every single department, every single discipline is related to all of this now, right? So we can have our symptoms, because it starts with the compensation, and those are already flags when we can visually see or feel some compensations. But the true, our body's finally screaming and waving red flags and saying, I need some help, when the symptoms show up, right? So and then it's because everything is connected. Our body's in this gorgeous symphony of everything being related to everything else. If something is shouting out as an issue, it's a message for us to pay attention, and not to pay attention to where it hurts, so to speak, or where, it's red and itchy, so to speak, or right, or what's a little inflamed down by my feet. Feet problems are directly related to our posture. And it's not just from the ground up. Certainly it is. I really believe in the right shoes. Barefoot, by the way. Barefoot.
I do love my PRI physical therapists.
Right,
I do.
So I believe it's from the nose down. There is some feet up, and then where does it all meet? Right there in the middle. So our sacrum is a major part of all of this as well, and that's right where the base of our spinal column is and our nervous system is. So, everything's connected. Everything has an opportunity to be why are you going to go seek help? Because my lower back hurts, or because I have digestive issues? We, as a rule, oh, it's so sad. Like we're taught to treat symptoms in dentistry and in medicine. I think it's like written somewhere in this is what you're going to do, get ready, because all we're going to do is treat symptoms, when in fact, everything we need to do is trace it right back up to the origin. Trace it to the origin. It's not hard. Our body is screaming the answers at us. And we have,
it's how,
it's the norm.
I'm so sorry. That's how that professional is trained in order to understand, in order to see those red flags, in order to see, and that's where the continuing education just simply doesn't stop.
Correct.
And in the state of Virginia, I have taken a lot of different types of courses from multiple disciplines in the healthcare field. And one of my favorite courses that I took, I can't practice it legally. I do it on my friends and my family when they come over to my house, because I got a massage table, but I took a craniofacial fascial therapy course, and I through the Gillespie method, and that was to allow me to have a better understanding of how I can recognize things in patients. And it's not just for me,
Right.
but for I'm speaking only for myself, but I think others who listen in on this and watch this, that they'll be able to understand and be able to connect and resonate with this as well, is that the whole body health, you just because you're in dentistry does not mean that you cannot make yourself aware of other things so that you know which vetted professional you know will be able to help this individual. And
Absolutely.
we don't want people to suffer. And yes, we are doing our jobs, just like a surgeon is going to do surgery. But at that
Exactly.
point, who else is part of that entire team? Now, why do you think airway issues go undiagnosed for years? What do you
Um,
like if you were
I
mhm,
think let me trace that back to the origin. I think
certainly.
I mean, I really do. I think it's just part of our, the education, the system of our education. And again, I don't want to throw anybody under the bus because even they are only doing what they're taught to do or what told to do, so everyone has their regulations but it turns into these cycles, right? And so I alluded to this earlier. In medicine and in dentistry, we learn from a body lying on a table. If we're fortunate enough to get close enough to see an anatomy, thank you to those who donate. But we what we're seeing is a body in a supine position, static, and we're memorizing body parts. We take a multiple choice test, we pass or fail, and it's like drill, like it's memorize, now go out and touch people. And we're like, but we don't, I mean, we do it because that's what so then we're very confident in what little keyhole that we learn from. We're all looking through different, like an ear, nose, and throat physician is looking through this keyhole, a cardiologist, an orthopedist, a general, so when we see kind of you open the door and you see the bigger picture, there's a whole body and dynamic motion. We're not learning on the in our anatomy labs about forward head posture, or if they're not breathing, we can't see if their mouth is open or not. We can't hear if they're snoring or have apneas. So I think it really comes down to our education. But so all of our providers, I never said, oh, they're never, they're terrible because they don't understand airway. I said, no, they're only teaching you because patients, and I think you guys, all of the listeners, and this, when you hear you're with somebody who hears this for the first time, and they turn red, they're starting to cry, and they're like, how come no one ever taught me this before? I've been going through this for so many years, why hasn't anyone told? I go, no, and I said, because they don't know. They're doing the best they can with the information they have. Like the system's broken a little higher. And I think where the information is there, the evidence is there, there's a
It's just being able to
resistance to
will
the
in. Yeah.
change. And I think but I think that if you look at any kind of change, that's part of the evolution of a change, right? First, there's going to be resistance. And because I think that the people in maybe a committee, I'm making this up, I don't have anyone in mind, but the higher ups, when they meet, they're kind of potentially a little ego driven, where they don't want to say, oh, maybe extracting as a rule might not have been the best thing. How are we going to tell the world that for decades we've been doing that? Well, we can't. We have to just say it wasn't the right, that it's fine. It's fine. We can keep on doing that, rather than, but I relate that to leeches. Well, we used to put leeches all over our each other's bodies, right? And it's like, well, we did the best that we could at the time, and with the information that we had, taking teeth out was actually, it was the standard of care for a reason. It was the best we could do with the information that we had. We have so much more information now, so we're kind of shifting our model and our teaching. Let's get up with the times and be scientists about this, because science evolves. Hypothesis and yeses and nos and try this, try that. Not, this is how we've been doing it, we're not going to make any changes. And it's just time. It's just time. Let's just. Oh, I just always,
Love it.
I
Oh,
get
I love
really
it.
excited because I know I'm sorry. I can't apologize for my passion. I get really excited.
No, you're
I want,
so passionate, Dr. Walker. I love this.
imagine if those higher, committees and boards and education systems and organizations would say, we're going to explain the change and get you excited about it. They'd be the heroes. And there would be this massive modern shift towards wellness and treating the origin, interdisciplinary care. Imagine being like, I inspired that before, if they're the higher ups, talk about ego. They could be like, yeah, I pioneered this shift and it changed all of medicine all over the world. You know what I mean? Wouldn't that be a much cooler ego issue to have, like way to make yourself feel good?
Yes. And just, there you go.
Yes, yes. Because I mean, I don't know. Everything it's connected, and when
It is.
everyone when everyone gets better, everyone does better. As opposed the fear and competition keep us in division, and we put us into the collaboration and the interdisciplinary wellness. Everything gets better. Everything.
Agreed.
Yeah.
100%. I have going on that whole connection with that airway connection. How does breathing influence facial growth and development? Could you explain that? Or
Sure.
talk about it?
Gosh, I love that one. I mean, if our nose is blocked, right? Remember, anywhere in the nasal passage, it can be just tonsils, it can be tonsils and adenoids, or just the valve, or, any combination. With that obstruction, our body is going to breathe. If we could use our ears to get air in, we would. But we have a default, thank goodness, right next door, which is our mouth. And so we use that to breathe. And if our tongue pressure then, which at rest, if our mouth is closed, has a neutral, natural pressure to keep our jaws, our upper and lower jaws wide, and with this proper swallow patterns that grow wide during growth and development, grow wide, tall, and more forward. If we need to get air over our tongue instead of keeping our mouth closed and using our nose to breathe, then that pressure is not there. And so the outside muscle pressure at rest, they're not going anywhere, right? So, and they end up being the only pressure, not neutralized by the tongue pressure on the inside. Then our upper and lower jaws can grow in a more, they'll keep growing, but they grow less, and they grow in a more unfavorable dimension, which then requires that we use our nose to breathe. So it becomes this cycle when we have to breathe over our tongue. And then, and that's a gateway to a whole other set of symptoms that I think we in dentistry and myofunctional therapy know really well, where the cold, dry, dirty, unfiltered air, because this has a purpose. It's not just that, this one's, we don't need, there's a reason why it's better. It actually warms the air, moistens it, filters it. And then nitric oxide from nitric oxide from our sinuses treat the air and clean it before it goes into our delicate lungs, right? And that is where the blood oxygen exchange takes place and sends it to every other organ and structure in our body. So there's an actual purpose for this. And as soon as that is compromised, all of our systems are affected, our posture, like I said, and our bony structures. And children grow around a breathing disorder, a structural need to open their mouth to breathe, right? But I always say, you're never too young or too old to start breathing. Whether you're 3 or you're 83, you're never too young or old to start breathing. It's just it's always easy to diagnose no matter what age, but it's easier to treat and manipulate our bones when we're in a growing situation as it is. So the earlier intervention is where, and that means day 0. Right.
Yes.
Just came out, let's check for some tethers. Right?
Yeah. And when you talk about, so moving into the functional part of orthodontics, what would you say would differentiate cosmetic orthodontics from functional orthodontics? What have you seen? Or what would you, if you could maybe say it in, I don't know, I know that you could read an entire chapter or speak an entire, not even chapter, an entire textbook on just this alone to
but
really
let's
dive
make a little
into it.
nutshell of it. That's easy too.
Yeah,
because
that cosmetic and functional.
Straight teeth are beautiful, right? And so people, as orthodontists, we were, it was kind of get the top to fit over the bottom, make them straight, and that's the reason, right, for cosmetics. Functional means when somebody can breathe in an ideal fashion, that's when the treatment is complete. And guess what? Your teeth happen to be straight. They happen to be, you have a nice broad smile following, you have beautiful lip support. You have, I mean, it turns out that the more cosmetic the solution, the better someone's breathing by our levels of what beauty are in the studies that, you know, we all read with beauty, you know, lip support, broad smiles and whatnot. Turns out it also happens to be a gorgeous airway underneath, right? So it certainly isn't about crooked teeth. Crooked teeth are a symptom, not a, you know, characteristic of attractive and unattractive, really. I mean, we have our opinions, of course, but it's not
That we
it's
do.
not
Yeah.
bad. Yeah, yeah.
Yeah. I want to talk a little bit more about sleep because sleep and breathing disorders, we see those every single day when we are in the grocery store, when we are working, obviously, in our in the mouths at our offices, and not just with dentists, but this happens to be with everybody in the entire on the planet is we can
Yes.
see when somebody's lips are not together and when they are just simply mouth breathing, which we know that there's a function for that the nose provides for the body, not just with that nitric oxide, but that clean air and that filtration and that moisturizing air. Um, how frequently do you see sleep disordered breathing in your patient population? So let's talk about your patient population first. So do you
Okay.
see more pediatric, teen, adult, or do you see that broad
Well, great
spectrum?
question. Just to clarify, I stopped practicing in brick and mortar about a year and a half ago. So I'll tell you what I've been doing.
Congratulations.
Thank you. So, I won't stay on that for, but I'll tell you, I'll answer your question. It's like, um, I'll tell you what I've been doing with my time in a little bit later, but I've realized I can help
Awesome.
so many more people with an avenue that I had to go down in all of this. But when I was seeing patients, I saw everybody, right? So, but people don't always know why they're coming to you. You know, when you just have an orthodontist written on your sign, people think it's about cosmetics and crooked teeth. And some people would go as far as saying it's for TMJ disorders. But unless you really had airway up on your sign, it wasn't really something that people would seek you out for. And even still, I remember I would talk to patients and explain everything about airway and how orthodontics related to it. And they would say, so do you just do like regular braces also? And I'm like, I just told you everything. Yeah, yes, the answer is yes. Yes, you're going to look great. You're also going to breathe. Yes, you're going to look great. But to answer your
You're in the
specific
right
question,
place.
you're in the right place. Everybody, right? So, you know, it's kind of how you choose to market yourself in a way. And it's also about your education. If you were taught that phase one treatment isn't necessary, you know, are you just doing it to generate an income twice? Right. Or are you doing, you know, so like people, we were taught that you have a kind of a choice of whether you're going to be a phase one, phase two, a two-phase orthodontist or a single phase orthodontist. It's really not the case. As soon as, you know, my father and I always did two-phase orthodontics, but how we would define that first phase was this is the medical portion. This is the part where we're setting yourself up once you start breathing properly, you know, whether it's things that we have control over or whether we need to combine your treatment plan with an ear, nose, and throat physician, you know, which was not infrequent, let me say, because there is only so much that we can do, as I said, as an orthodontist, but instantly it's an interdisciplinary evaluation, right? But so we would encourage, and then even when I think it's the AAO says that we should be evaluating children by age 7, I'm like, they're ancient by the time they're 7, and I don't want to put
Geriatrics.
exactly, and it doesn't mean braces and wires when they're 4. You know, it doesn't mean an it means let us evaluate you so we can find out what the most appropriate. It could be at that point where myofunctional therapy is the most efficient way. It might be only ear, nose, and throat. It might be a combination of the two. It might be slight orthodontic removable something. Who are you and who you are? We need to know where your obstructions are, what your growth pattern is, because it's a crystal ball. We can see who you're about to be when this isn't working and when this is. So so I saw a lot of everybody, to put it.
Yeah.
Yeah,
That's a great answer. It's a perfect answer. It really is because it covers everybody. And what you're saying is that you're recognizing this in everybody, and bringing it to their attention, even when they come to see you and they just don't even know why they're there, just like you said.
Exactly.
And you are able to help
Yeah.
them become aware. Then what symptoms should clinicians never ignore when screening?
Oh my
Or
gosh.
maybe, right?
I'm
Right. I
like, I
know
looked at
it's
the clock.
amazing.
How much time do we have?
I know. I want this to be a
Right.
3 hour discussion. I really do. And you know what?
Amazing.
Maybe we can have you come back
I would
and
love to. I would
and
love.
and really hone in even
Yes.
deeper on these here.
Yeah.
And you can introduce us to your book that I just declared you writing, just so you know.
Oh,
Yeah,
well,
you're
different,
gonna write a
different. No,
book.
it's not a book. It's no, well, it's a solution to all of this, because all of
Great.
us have, airway care has just been so fragmented. We're now at a place. You've been talking about this for years. I've been talking about this for years. A lot of us have. Some of us are just now getting a new education on it. Bravo. Some people have been doing this and they're pioneers, and but there's always something to learn. Then some people have been saying this doesn't apply to me, or it doesn't apply to medicine or dentistry, and they're starting to realize that, like, I'm seeing the evidence. So there's a level where everybody is, and I've put together a resource for all of those levels, for all providers, that all in one place. So
Fantastic.
we'll talk about that later. I don't want to. I don't.
Yes.
I don't want to. I cringe when last thing I want to do is sound like I'm like
Selling it off.
selling anything. So don't let
Yeah.
like edit.
I think
I
it's
don't want to.
fantastic. I think putting it all together and being able to allow something easy, resourceful for all clinicians and
Yes.
all other providers in all disciplines, to be able to see things. But yeah, some of the symptoms that I would say as
Yeah.
myself as a clinician is walking through Central Park, even though I'm in Virginia, but
Yep.
like just walking through some of the things that you can immediately see is the mouth breathing. Number one. Number two,
Yep.
you can see the structure. Okay.
Yep.
You can see that bony structure, like you had said, but of course it takes a trained eye to see that. But what about toe walking? And what about,
Totally.
the focus or the behavior of these children when they're walking with their parents? Or,
Yeah.
how is it that that
Yeah.
that no one else can see so many of these things, but parents are just so enamored by the grace of what some of their children can do and perform, and they just don't see some of these other things because we're all busy, and
Right.
that's just our nature now,
Sure.
is that we're all busy. So when our families come into our offices in the dental chair or any other offices,
Mhm.
what is it that we can see?
Mhm.
Even the receptionist, the front
I
desk,
was just going to say, it starts before they even
right
get
when
into
they
the chair.
walk in.
Right. Exactly. So,
Exactly.
yeah. You have someone uh, lightly trained. They don't have to be it just, if whether or not they're using their mouth to breathe while they're sitting waiting for you, when they're um, when you're walking them to the back, are they walking with their toes together, or are they in the exact opposite? You know how people, they walk around with their head up. That's a more open airway, right? Kink toes, open hose, right? So when
Very
we
true.
have that head up position, it's not, or even a head down position. Where are we putting our head? If it's anywhere other than the ideal, head stacked right over our spine, um, lips together, where are our eyes, if we're getting really, if our eyes are down, our eyes go where our head is pointing, so we can see that. When we're not even in the office, Central Park or at a restaurant, are we chewing with our mouths open, or, because we can't breathe if we're supposed to be able to keep our lips together, breathe, and take turns breathing and swallowing at the same,
Gulp, gulp,
gulp,
gulp,
gulp, right?
belching, lots of gas.
Belching, right? I mean, they're susceptible to choking too, because they're pulling air in over that food while they're mouth breathing, and then it can get lodged in the esophagus. So it's like,
Yeah.
there's that. If that those cute laughs where there's a little snort during the laughs, that's right there, and that's a waking up, right. So this is something, because we're not gasping and pausing during the day, we're not really snoring during the day, even if we have a little chortle in our laugh, but when we lie down, gravity makes that already narrow airway even smaller, right? Then our muscles lose tone. When we fall asleep, it gets even smaller, and so that's when we start making noise or pausing and gasping. I mean, apnea is silent, so we can't just say, "Oh, I don't snore." It's like maybe you're stopping breathing altogether. Oh, I don't do either, and I use my nose to breathe. Does that mean you're still a really solid breather? Not necessarily.
Yeah, yeah.
Yep, because you see, you see that wear on people's teeth where they're flattened out, canines are flattened. This happens in children all the time, where you see their deciduous teeth really flat, and parents will say, I can hear them grinding their teeth. You don't even have to hear it, right? So it doesn't have to have volume, right? That's not the only way. But that grinding, right? That grinding is our survival mechanism, because our body is perceiving less oxygen and more carbon dioxide. Our brain has an automatic chemical trigger for that, to start moving our lower jaw around when we're lying down and asleep for that. And that, because if we move our lower jaw around, we're bringing our tongue forward as well, which opens up our airway and keeps us alive for just that one more breath. But we got another breath to do. What are we going to do? We're going to do that again, right? Yeah. So all night long, we're going to be clenching and grinding. And then what is the ultimate journey for that? Is if our teeth used to be this tall, we grind them down, now they're this tall. What just got smaller? Our tongue space, right? So where does our tongue go when there's no more room in the mouth, except back into that airspace, right? And then where does our head go? More forward, right? And then what do we do when we lie down? It gets even easier to collapse, and then we're struggling. So like we end up, to save our own lives, we end up causing more symptoms. But the right here, right now is way more important than, our body's not going to say like, let's not grind our teeth down because that's going to make it harder to breathe tomorrow. Well, there is no tomorrow if we don't breathe right now. So we're going to grind our teeth down no matter what. So we end up, creating our own symptoms as, again, it's a flag, because you take that all the way back to the origin, I mean,
when you're talking,
oh no,
I'm sorry. I heard pause.
Please. I mean, yeah, because I had to breathe.
I know, right? And I'm ready. I'm like,
please go, please, because I mean, like, if you get to the chair, I mean, this is a thing. Like people who are, taking an FMX, if they're gagging, right? That's the gag reflex that's really heightened. Is our body's survival mechanism saying, hey, I need to breathe through that hole. If you're going to put a film in there, or a mirror in there, or a toothbrush in there, that's threatening my survival. And I'm not going to let you anywhere near that. So we're trying to get it out. So, I mean, so there are symptoms everywhere. You can have them look up. Are there holes there? I mean, really, like I said, their symptoms are everywhere. Yep, there you go.
Nasal collapse. I know. I actually have the Marpy in my mouth right now. So.
Oh, good girl.
Yeah. 5th round of orthodontics. Here we go.
I know, right?
Oh, I know it. Oh my goodness. You have a lot of information in between your ears, and I want to just extract everything all within a 60-minute time frame. But I can't. Right?
Yep. So no, keep going. Keep me on track. I could just go on and
on. So oh my goodness. We really talk a lot about, just because I brought up the Marpy, and I brought up about, a little second about the nose, but what role, and you were talking about the space and losing that space in the mouth when you are grinding down those teeth. What role does arch development play in airway health?
Everything. I mean, that's the same. It's, we touched on it before, tongue space. And if we're not nasal breathing, we're not developing our own arches, right? So
Then how do we get there? How do we get to that next point?
by unobstructing the ideal breathing passage, which, and whatever it takes, it can, and like I said, each patient or each parent for their child is going to have an opinion on how they want this, or heart, or, they might be, medically unavailable to have a surgery, or medically, or something unavailable to have, maybe let's just say financially unavailable to go through orthodontics, because orthodontics is recognized not as medical but as elective, right? So there's always a ticket, that a price ticket that goes along with it, that not every person can afford. So sometimes the only way to address an airway issue is through surgical experiences, whether it's orthognathic, and or ear, nose, and throat physicians. So with all of that arch development, it's critical, but we need to either manipulate it or help the patient manipulate it for themselves. It depends on their age. It depends on their availability. It depends on everything, depends on everything, because guess what? Everything is connected.
That's right. And speaking of the connection, let's talk briefly, let's talk briefly about how breathing, the airway connection, influences muscle tension and craniofacial pain. So bringing that to TMJ disorders, and then the whole cranium, seeing, and here's another team member that you bring on to your team of collaborative interdisciplinary care, craniosacral therapist, that myofascial release provider. So everything is connected, not just through that fascial line, but through muscles. And we hold these joints and these movements all together by muscles, fascia, connective tissue. So how does breathing influence muscle tension and craniofacial pain?
I touched on it before, and it's another part of the same story of where, if we're obstructed and our position changes, our nervous system is what makes muscles function or relax, right? Either activate or deactivate. So when the body is feeling an emergency, right? Fight or flight, or in a rest and digest, repair, rejuvenate, heal, grow phase, which one are you in? Right. So if this isn't working, our body is, and we accommodate so well to everything. Look at how, we adapt to struggles at work, struggles in life, struggles at home, struggles with this or that. We're very adaptive. So if we're adapting to a struggle to breathe with those compensations, then we are adapting to being in a fight or flight situation all the time. But there's no question, even with that, our body is creating inflammation, right? And so that inflammation creates more stress in our body. And if we have more stress in our body, that amplifies all of our stress hormones. And then our stress hormones are working on our organs, and our organs aren't working that well. So it goes back to our nervous system and our and then the invisibles, oh God, I'm taking your question to another level, not just
Which
the
is
muscles.
great. We want to hear this. Yes.
It goes beyond to the things that we can't see, like our anxieties, or whether or not we have peace of mind and the ability to pause and rest, or if our body's always in that fight or flight, then we're always, if we're not getting into deep stages of sleep for all of these reasons, then imagine, we've all done this. We've stayed up a little too late or all night. And, right. And so how do you feel the next day? A little jumpy and nervous and like anxious. Maybe you could cry a little more easily, either to happy or sad. We're just in a little bit, a much more heightened state of sensitivity and anxiety and fear and whatnot. And so imagine if we're doing that every single night. We're used to it, so we don't really recognize that we're kind of staying up all night in a way, because we're not getting into deep stages of sleep to repair and rejuvenate and heal. Then our body's in that crisis mode all the time, and then we get diagnosed with anxiety disorder or depression or something along those lines. And what do? We go to our depression doctor and get a pill, or and yay for the band-aids, because we feel better. I'm not saying don't if we're bleeding, we put on a Band-Aid, but you got to make sure you're treating the bullet wound underneath. You got to make sure you're treating the origin while you're using the symptom support as well. So I
Nicely
mean,
said.
it's all connected.
It is.
You name it, really.
Yeah,
I know
yeah.
I get so roundabout and I'm talking, but
I think it's
I can't keep it in one. You can't just have it isolated in one answer. Everything goes right back to itself right here.
I think it's great. I have a couple of wrap-up questions
Sure.
because I want to hear a little bit about the AirwayZ. However, I do want to know if a provider suspects an airway issue but feels overwhelmed, or maybe just unaware of what to do next, where should they begin?
Well, we're going to talk about AirwayZ, it turns out.
Fantastic.
Right?
Okay.
I don't mean to push it, but like this is what
Yeah.
in all the years that I was practicing, and we've had so many conversations like this where, how can we get providers to get help? Because what's really popular now is airway, right? It's becoming something that everyone, even reps are saying, "Hey, doc, you got to get airway into your practice. It's a real moneymaker." I've heard it and I'm like, oh my God, it's people, there's so many courses out there. How do you know what courses to take? How do you know what information is accurate and what isn't? Where do you look to see what evidence is accurate and what isn't? What resources in the office would be most supportive? All of it. So I created AirwayZ to be the answer for that. And one of the bigger pieces of it, I don't mean to, I'm not trying to be,
Please tell us, how are we going to
tell
know?
you, the
Tell
biggest
us.
piece of what I have created is a patient education system. So it's a video where providers through AirwayZ send the video to patients before they arrive for their first consultation. So everything we just talked about in this past hour is consolidated to 15 minutes because it's combined with visuals, right? And it all in a nutshell, where the patient arrives educated. Right. So when you're informed, you're more likely to be able to connect the dots and relate it to you. And I mean, this is whatever discipline. This isn't for just dentists and orthodontists, or anyone in the obvious kind of airway space. But it's a video that teaches for all disciplines. I have an ear, nose, and throat physician who showed it at an ENT conference, and it just set the stage. Imagine even just at a conference, it set the stage for the providers there to start connecting the dots, which set up for all the following lectures that went through. So it's the time for solutions, because we've been collecting all of the challenges for decades now, right? And so, and the challenges are the roadmap to the solutions. So I just went, okay, here's a problem. Interdisciplinary is a problem. The education, the evidence, who knows what courses to take. And how do you get your patients to understand, right? So I put it all in one place. And I just launched last week, so it's a work in progress. But
How can we find it?
Absolutely. It's
Can you
airwayz.com. It's as simple as
tell
that.
me where we can find it? Great.
Absolutely. Yep.
That's fantastic. Now, is there a subscription to it for patients and providers, or just providers? How does that work?
Everything is available on the website. The video system is a subscription because we do all of that. And I don't want to get too, again, I just don't want to be salesy. It's not about that. I wanted to be a solution, but it's a whole program where they don't have to lift a finger, and we send that video out to pre-educate the patients. And it's followed with a questionnaire that says, okay, you just watched this video. What didn't you tell us on your health history that you might want to tell us now? And so they go, oh, I used to wet my bed. I used to suck my thumb. I have a high gag reflex, or my child does, whatever age. And so then that goes directly to the provider on their dashboard. So they can just go, okay, you just mentioned ear tubes in your ears all when you were a kid. You just mentioned this, and this. See how this is related. And now whatever. And then they still get to be the doctor, but they've just condense their consultation from an hour and a half or 40 minutes or whatever it used to be to get right into what the patient's needs are. And the patients appreciate it too, because they usually left my office with answers, but which led to more questions. So the second appointment was repeating the same thing as the first appointment, right? So I had to, this. So it eliminates all of that to be more efficient, effective, which which prevents provider burnout, which allows you to see and heal more people in one day, which, yay, people get better. And at the same time, you can be more productive. So your staff is on board when they see this. You're not just like, oh, she's talking about that airway stuff again. No, like it's legit now, like there's some
I think that's
credibility
great.
behind it. Thank you. Thank you.
It sounds
Check it
very
out. There's a
organized.
preview and there's access to the full video so you can see that through it, but check it out and give me feedback. Cause there's something that I think is pretty exciting too on it and this is all.
Oh no, Dr. Walker, you're frozen. You look beautiful, but you're frozen.
Oh no.
Okay.
Is it better?
Yes, you're back.
Pretty while it froze. Okay. So it's called a career connect. And so I'm going to have it, because someone gets involved and they're like, I don't want to work for my general dentist anymore, for example. I want to find someone who's interested in airway. And so you can go have a direct connection to someone who might be looking for a new myofunctional therapist to collaborate with, or an assistant to hire, or a practice to sell. So it's kind of like a mini Indeed for airway. But my favorite part of it is there's a collaboration one where I'm not looking to hire. I'm not looking to be hired. I just want to have someone that I can maybe refer to in my area. Right. So I'm just trying to be like the answer to, it's so silly, AirwayZ, right? Everything airway from A to Z.
From A to Z. I think that's brilliant. And it's easy to remember.
Yeah.
Wow, Dr. Walker, we are just so honored to have you here tonight on Thursday Night Live with us. It's just been such an honor and such a pleasure having you here and sharing your AirwayZ with us. So it's AIRWAY, the letter Z.com. And that way everybody can log on, find you that way.
Yeah.
And just be so fantastic to have you come back and join us again. And we'll be sure to reach out to you and to move forward again a little bit more. And to all the providers here listening in, invite your friends, invite your peers, invite your colleagues to listen to Airway Circle, especially Thursday Night Live. We have so many wonderful providers here helping share the good word about airway and just helping us grow, because it's the whole body, just like we've said a few times today. It's all connected. So where do we go from here? So Airway Circle does have the free directory, which means put yourself on the map, put yourself on all of these directories that are being offered, because it's not just patients who are going there, it's also providers who know about these directories. And then we can check your website and we can refer patients to you from other locations. And that's how Airway Circle likes to collaborate and to bring everybody together that way as well. The free directory is just so important for everyone. Become a member today and have access to all of these recordings that we have here. Renata has her Beauty of Breathing podcast as well, and that's beautyofbreathing.com. Absolutely a joy to have you here with us. And I look forward to seeing you at some of these conferences, or I hope to meet you in the very near future. I would like to come visit my family up in Vermont, where you are.
Please do. It's
yes, I would love it. And go back to my my northern roots. Oh goodness. Well, again, Dr. Walker, any last words that you have for us?
Well, thank you so much for having me on the podcast. It's really been an honor to be able to express my passion and everything. And I think the last thing I'd want to say is where we started before we went live here, just to stop, to have airway not be a niche anymore, to have it be the absolute standard of care, the medical norm. And what we're doing, what you're doing is so powerful in spreading that word. So thank you, and keep going. Don't stop, and breathe through your nose 24/7.
Amen. Oh, what great closing remarks. Dr. Dr. Walker. I look forward to talking with you in the near future. Everyone
Thank
have a
you.
great evening, and don't forget to share Airway Circle with your peers and colleagues. Take care, everyone.